Good evening, everyone. Welcome. Thank you so much for joining me today. Meg Wheeler. I'm a candidate for State Senate in the Plymouth and Norfolk District. To everyone joining me on Instagram, I apologize for kind of the funny angle today. We've had a tech issue that we're working through. But I'm joining you tonight to give you another update on the COVID-19 situation. So, very sadly today, we saw an incredible increase in deaths, 33 additional deaths today. That brings our total deaths in Massachusetts to 89. This was the deadliest day of the outbreak so far. I think this is perhaps an indication that we're starting to get into the surge that people have been concerned about. But nonetheless, it's important that we continue our efforts to socially distance, to stay at home, so that we can keep that as low as possible. 13 people also died today following an outbreak at a veteran's home. This is currently being investigated by the state. 6 people of those 13 did confirm positive for the virus. 5 are being tested. It's unclear right now how many of those 13 are included in the 33 total that they're reporting have passed away today. So in terms of cases, our total statewide is now at 6,620. That's 868 new cases today. 4,142 people were tested today. That brings our statewide total to 46,935 people who were tested. And then across the United States, over 178,000 people have now tested positive, with over 3,500 deaths. So, as you can probably see, the severity of this is increasing. We're seeing more people every single day test positive for this. We're seeing more deaths every single day. This is becoming truly an outbreak, and is something that we need to take very, very seriously. So from a statewide perspective, the governor today announced that he is extending the timeline for non-essential businesses to be closed through May 4th. That lines up with the deadline for school closures, which was announced last week. This extension also includes the limit on gatherings to 10 people or less. So that is also now through May 4th. Governor Baker has said that he predicts, based on the researchers who he's working with, that he predicts the surge in Massachusetts will occur between April 7th and April 17th. So, unfortunately, it sounds like the worst has not yet hit us. That's why it's incredibly important that we continue to stay at home as much as possible, that we follow the state guidelines, and that we practice social distancing measures as much as we're able to. If we're non-essential, we should not be out, basically. There was also an announcement today that hotels, motels, and online services such as Airbnb may now only offer rooms for limited purposes, including, quote, direct efforts related to the fight against COVID-19. So the governor was very clear today. This is not the time to be taking a vacation. This is not the time to be traveling. They are limiting the availability of those rooms just for very extreme purposes. Lastly, the federal government approved the state's request today to open 3 field medical stations, the first of which will be in Worcester. The state is still looking for appropriate locations for the remaining 2. I do want to reiterate, I said this yesterday, but one of the biggest challenges that we're facing right now is the lack of PPE, personal protective equipment. Excuse me. So far, Massachusetts has only received 17% of what it's requested from the federal government. The state has set up the option to either donate or sell if you have any PPE, if you manufacture PPE, or you just happen to have any if you're a business that would have stocked it. You can donate or sell that by going to mass.gov. They've set up a form for you to be able to get them those resources that they so desperately need. And lastly, I've said this several times already, but I just want to reiterate this, that staying home is incredibly important right now. If you are not essential, there is no reason for you to be out right now unless you are getting food or prescriptions or for medical purposes. It is so incredibly critical. The next 2 weeks are so incredibly critical to ensure that we can flatten this curve, that we can stop the increases in both number of cases and numbers of deaths every single day. the next 2 weeks truly are going to be a critical period for all of us. I know how incredibly difficult this is. I haven't seen my parents in weeks. My son hasn't seen his grandparents in weeks. It's incredibly challenging. It's really hard, especially when we're worried about our family and our loved ones, to have to interact with them and connect with them from afar or over the phone. I know how challenging that is. We're feeling it in our family as well. My husband's family is down in Austin. We haven't seen them in months. We're very concerned, but we know that staying home is the most important thing we can do right now. And it's the best way we can help everyone who is fighting on the front lines to ensure that this virus does not spread anymore. I'm going to repeat it again. The next 2 weeks are incredibly critical. Please take this seriously. I am terrified that if people do not take this seriously, that the death count in this country will be immense. And it's already more than it probably should have been. I do want to thank everyone who has done an incredible job of staying at home. I have talked to so many people in my community who are doing it, and it's tough. Folks who have kids who are struggling to keep their kids occupied and their jobs being accomplished. I get it. But thank you so much to everyone who has done an incredible job of staying at home and respecting the social distancing measures that were put into place. Excuse me. I will say, on a positive note, there are some early signs that the increases in the number of cases are slowing down. And we're especially seeing this in places where social distance measures have been in place now for a bit. So there is early hope that what we're doing is working. And that's why it's so incredibly important that we continue to do it so that we truly can flatten this curve. Now, I want to turn to another thing really quickly before I wrap up tonight. And for everyone watching live, thank you so much for joining. If you have any questions at all, feel free to drop them in the comments. And Tora, I see your question. I will answer that. Let me actually answer that first before I get to my next point. So this is a great question. What's your stance on universal basic income and disabilities inclusiveness and paid internships? And then you asked, what's the best part about being a community advocate, and what advice would you give to young folks who have a passion for public service? Oh my gosh. Okay, these are incredible questions. Let me take them one at a time. So what's your stance on universal basic income? Excuse me. Apologies for my cough. I'm dealing with a little bit of allergies right now. So I am absolutely in favor of continuing the conversation on universal basic income. I am fairly convinced that we need a measure like universal basic income to ensure that every single person in this country has a fighting chance and has the ability to afford their basic needs. Universal basic income makes sense to me. I think it's a plan that would probably work. But candidly, I want more information. I want to understand a few additional pieces about exactly how we would implement it. I'm the kind of person who, because I run a business, I deal with the implementation of projects and initiatives. So I want to fully understand exactly how that's going to work, because I want to make sure it's actually going to work. Like, that's my big thing. I don't want to just put a talking point out there that sounds great. I want to make sure it's something we can actually do. I also want to make sure that it's something that is actually going to help people. Again, like, I look at something like the stimulus check, the $1,200 that a lot of people are going to receive, which, let me be clear, I think is an important step, and I'm glad it happened. But I don't believe it's enough. And so it's situations like that where I don't want to just be in support of something only to find out that it doesn't go far enough and it doesn't help people as much as they need. And so that's my general sense there. Okay, so you had some additional questions: disabilities, inclusiveness, and paid internships. So I am 100% in support of paid internships. I actually don't think internships should ever be unpaid, perhaps in rare circumstances. We don't currently have interns on our campaign, but we have made it a commitment that if and probably when we bring interns on, they will absolutely be paid. Every single person of my campaign team right now, unless they're serving in an advisory role per their choice, every single person is paid on this campaign. I believe that is critical. Disabilities inclusiveness. So yeah, this is actually, I'm really glad you brought this up. We recently brought on a team member who to the campaign who is an incredibly passionate advocate for for disabilities inclusion. And one of the reasons why I brought her on is because this is an area where I want to learn more. I've known for a while now that this is an area where we as a society are failing people, but I didn't completely understand exactly what steps we could take to change that. And that was on me. That was on me to do the research. So I've brought her on, and she's already been an incredible part of our team and is contributing to that conversation. But let me just say, whether it's things like funding, whether that's universal income or that's the stimulus bill, and unemployment, to simply making our interactions with people in society easier, we need to do more for folks with disabilities. As I'm learning more, I'm realizing how much people with disabilities are being left out of the conversation, and that is not okay. One of my biggest things that I stand by in this campaign, and will stand by when I'm in the state Senate, is making sure that all of the stakeholders are at the table. And I don't think that that's happening right now with a lot of the bills and the conversations that are happening just in general in government, not just at the state level. So for me, that's an incredibly important conversation to have, and it's one that I look forward to having more of. And so to answer your next question, what's the best part about being a community advocate, and what advice would you give to young folks who have a passion for public service? I love this. The best thing about being an advocate is really the ability to see change in everything you do. As I go through my day, I'm a big advocate for women in particular. That's what my business mission is built on. So I'm going to talk about that in particular. As I go through my day, every single day, I think about how can I be helping the cause of women. And what's cool is that I can do it in small ways. Like, I don't need to go be famous or, do something incredibly big and amazing that everybody knows about to be an advocate for someone. I love that I can be an advocate for someone in all of my little actions. Back to your question, your point about disabilities. I think about just even on our campaign, even making sure that our videos have closed captions, which we do right afterwards. We're not quite at the point yet where we can do them live. We're working on our technology. But doing that, or making sure that our posts have the closed captioning that they need. Little things like that can make a difference for people. And so for me, that's the best part about being an advocate, is just the ability to wake up every single day and make a difference. What piece of advice would I give to young folks who have a passion for public service? Stick with it. It's going to get tough. There are going to be a lot of naysayers. There are going to be a lot of trolls. There are going to be a lot of people who tell you that you're young, or you're naive, you don't know what you're talking about, you're idealistic, you're optimistic, that's not how the world works, you need to be more realistic. And you know what? Those people, they're wrong. They're absolutely wrong. We need people like you. We need people who care, who are incredibly passionate. We need you to wake up every single day and fight for what you believe in. And that, to me, needs to happen more in government. We need more passionate people in government, because I think right now we have a lot of people who have become incredibly disillusioned by what government can do, by the incredible power and impact that government can have in improving the lives of people. And so if you have a passion for public service, stick with it. It's going to be a tough and bumpy road, but I promise you, I do not regret a single day on this campaign. I do not regret it. Okay, great. Sabrina asks, how do you feel about this pandemic impacting the debate over Medicare for all? Oh my gosh, I love this question. So I am 100% a supporter of Medicare for all. Let me just put that out there. I don't know that we've talked about this yet before, but I am fully in support of Medicare for all. So up until a couple of months ago, I've always been very supportive of healthcare for all, affordable, accessible healthcare for all. But admittedly, I didn't know the best way to get there. When Obamacare came out, I thought, okay, maybe this is it. Maybe this is the answer. And I think we all learned that while it got us further in the conversation, it didn't get us everywhere we need to be. A few months ago, I attended an incredible presentation by several groups in Massachusetts who are fighting for Medicare for all. And I I'm a numbers girl. They showed me the numbers, and I am convinced 100% when you look at the numbers that Medicare for all gets us better quality healthcare at a cheaper price, for everybody, for the government, for individuals, and it allows healthcare to work the way it's supposed to work. It takes out the middleman. It makes it easier for medical professionals. It makes it easier for patients. It just, to me, is a better system, and it accomplishes what healthcare is supposed to do, which is take care of people. So I'm fully in support of Medicare for all. I think this pandemic is going to affect the conversation. Here's the challenge. If I can be completely candid, here's my worry. We see this every time there is an incident of gun violence in our schools. Every time there is a gun tragedy in this country, people get their hopes up thinking maybe now will be when we finally have this conversation and finally get safer gun control restrictions, right? But it doesn't happen. So this is my worry about this pandemic and Medicare for all, is right now when we're in the thick of it, people are saying, this is not working, this system is broken. It is on us, people like me, people like those passionate public service advocates, to make sure that this conversation does not die once this pandemic is over. Tora says, what advice would you have for folks about lobbying elected officials from both sides of the aisle on issues? Yeah, look, here's the thing. I think the problem with what's happened over the last few years in this country is it really has divided a lot of people, and it's made that wedge bigger. However, at the end of the day, most people in this country want the same things. They want to be able to live their lives as they want, to love who they want to love, to have access to healthcare and quality education, to be able to afford their homes, to be able to have meaningful work that pays them well, to be able to put food on the table, to be able to retire. These are things we all want. And so I think the challenge is really cutting through the crap, if you will, and getting to the heart of what we're all after, what we're all fighting for. And so I think that is about developing relationships with folks on both sides of the aisle. I mean, look, I'm running as a proud, unabashed Democrat, 100%, and I believe we need more progressive Democrats in the state house. But that doesn't mean that we don't develop relationships with our Republican counterparts. There are more things, I believe, that bring us together than divide us. And I think it's on us to have leaders who build those relationships and those coalitions without sacrificing our mission or our goals. And I think that's what's happened a little bit too much with some people who are claiming to sort of bridge that gap. Do you support free college reform to help with student loans, Bernie's plan? I love these questions. This is great. We're getting to all the good ones today. Here's the thing. So let me start from the beginning. I 100% support affordable college for every single person in this country that wants it. I'm nervous about free college for everyone. And I'm being completely honest with you. This is probably the non-politician thing. I'm probably not supposed to say this. But I'm nervous about free college for everyone, and here's why. Because I know that when I'm handed something completely for free, I don't work as hard at it. Now that said, I'm not sure that argument is enough to stop us from giving free college to everyone. Because at the end of the day, when someone who wants a college education can get a college education and they're not burdened by thousands of dollars of student loans, that makes a huge difference for their productivity and their happiness and their passion in life. As someone who has 6 figures of college loan debt, let me just tell you, that is a tough burden to go through life with. It is a tough burden. So my short answer to that is I am incredibly open to Bernie's plan of free college for all. As I said at the beginning with universal basic income, I want to know exactly how it's going to work, and I want to know exactly how we're going to pay for it, but I'm definitely open to it. Tim says, how do we tackle climate change on the South Shore and do our part to reduce emissions? Tim, I love it. We're going into the big questions. Excuse me. Well, let me start with this. What I find fascinating, well, not that fascinating, is I read an article today. I apologize, I can't remember the source, on the fact that now that people have been staying home for the last few weeks, that we're actually starting to see reductions in emissions in this country, and we're starting to see glimmers of hope that that Mother Earth is recovering from the incredible damage that we've done to it. Now, we know that life is going to go back to normal, and so this is probably incredibly short-lived, but I think this is just proof in our faces of how we have got to take steps to reduce emissions. And this happens in a variety of industries, in a variety of areas. This happens in the way we build. It happens in the way we travel and our transportation. You know, one of my big issues is bringing accessible, affordable transportation to the South Shore, transportation that isn't going to be broken every week. But I absolutely do not think we should do that at the expense of the environment. I think a big part of that plan is ensuring that the transportation solutions we're seeking are ones that are environmentally friendly. So I think that's one of the big things to start off with. But I also think, again, that it goes across the board. It's transportation. It's in our building industries. It's, look, I'm one of these people who recycles, and I try not to use plastic, and I bring my, reusable water bottle everywhere. And those steps are really important, but we're not the ones who are causing the greatest amount of impact on our climate right now. It's big corporations, and we've got to get regulations in place that stop them. Tora says, you have my full endorsement. Oh, well, thank you so much. I really appreciate that. I think I kind of answered stance on climate change, clean air, creating jobs. Okay, I love this. This kind of goes back to what I was saying before, where I believe that every single person deserves to have the ability and access to have what they need in life, to have healthcare, to have education, to have a stable home, to have a job that is meaningful to them, that pays them well, to be able to put food on the table. So, job creation to me is incredibly important. But I also think we need to do it in a way that isn't just creating jobs that look good on paper, but is actually creating jobs that help people live their lives and don't put more people into a situation where they have to work 3 jobs or they can't pay their student loans or any of that. So to get into some specifics, I'm in support of raising the minimum wage 100%. I'm also in support of putting more government funds behind job training programs, job creation programs. And back to the question about, education funding. I mean, this is one of those areas where if we do make college more affordable or perhaps free for everyone, then people have more flexibility in the jobs they can take. I mean, one of the conversations in my household for the last few years has been, my husband's job and his flexibility, because he has over $200,000 in student loans. And that really limits where he can go and what work he can do. So I think that's a big part of it. Along those lines, I also want to see programs for encouraging folks to go into teaching, to go into the medical fields, to go into the fields that truly we're seeing now are the heart of our communities. And encouraging them to do that, but also offsetting some or all of their student education costs so that they're able to do that and they're not worried about not being able to go into those jobs because they can't afford it. Okay, I want to make sure I'm keeping up here. What's your stance to make venues more handicap accessible? Well, I mean, look, I think that, at least for me, that feels like a given. I mean, our society needs to be more handicapped accessible. Our society needs to be more accessible for people with disabilities. And, I think the challenge we have here in New England is a lot of stuff was built a really long time ago, and making that change can be really expensive. But I think that's where we at the state level need to work with folks, need to work with businesses and communities to implement those changes. So absolutely. Tim says, how do we support veterans and military families in Weymouth and the South Shore? Tim, it's a great question. Excuse me, I have to take a little water. And I do actually have to pop off in like 2 minutes because I'm actually teaching a webinar in my business. So I apologize, but I will answer these questions and then I'll hop off. So it's a great question, Tim. Look, veterans and their families have made incredible sacrifices for all of us and for this country. And one of the things that struck me when I started really talking to people who either were currently in the military or were veterans is the lack of support for our veterans when they either come back or they leave the service. I have, I think about my grandfather who was a Marine, and I think about how proud he was to be a Marine and how honorable of a thing that was. And then I look at the situation with veterans who are not getting access to the healthcare they need. They're struggling, if they're on disability, they're struggling to survive, to afford the basic necessities. They're frankly being cast aside in a lot of situations. And I think that's unacceptable. So, to me, one of the biggest areas where we can support our veterans when they come back is in the health and mental health area. Every time I hear about a veteran committing suicide, I feel like as a country we failed. We failed to provide them with the basic care they need for the incredible sacrifice they made for us. So the biggest thing for me will be increasing funding to our programs that will help veterans get better access to health and mental health care, that will help veterans get more financial support so that they don't have to worry about working multiple jobs. They don't have to worry about having affordable housing. What's the best part about running for office? Great question. What is the best part? Honestly, it's getting to meet a lot of people and talk to a lot of people. I thought I was pretty well informed before I did this, and I think I was, but you don't ever really know what's going on in your community till you actually get out there and talk to people. And, I sit on the advisory committee in Cohasset, and I've met a lot of people in Cohasset through that. But doing this, I'm meeting a lot of people in the whole district, and I'm learning about what everybody is worried about and what everybody's excited about and what people love about this area. And I'll tell you, back to the question about working with folks on the other side, I've met a lot of Republicans in this process, and that's important to me to have those conversations because I want to know what people are struggling with. I want to know what they care about, and I want to know how we can help. And so for me, just being able to meet my community members, to be able to support them, and to be able to take all of that I'm learning and bring it into the State House and be a vocal advocate for them is something I'm really looking forward to. So, all right, folks, I'm so sorry. I do have to hop off. Thank you all for the great questions. You are all incredibly amazing. I'm always happy to answer questions. So if you have more, feel free to drop them in the comments. I do just want to wrap this up really quickly by reminding everyone that tomorrow, April 1st, is actually Census Day. So this happens every 10 years. And this is really important because it determines how many representatives each state gets in Congress, which of course, as we know, determines how much funding we get for healthcare, for disability access, for climate change, for our roads, for all of that. So you are required by law to complete this census. There are fines if you do not. This is actually the first year that all households can do this online. So you should have received something in the mail, but please, please, please fill that out by tomorrow if you can. What would normally have happened if you did not fill it out by tomorrow is a field team essentially would have been dispersed and going to all the different houses and checking in on folks. That has been pushed back to April 15th. Candidly, I'm guessing it's probably gonna be pushed back even further. So that's why it would be very helpful if you can do it by tomorrow so that we don't have to worry about people being out there. As an FYI, there is not a citizenship question on the census. Thankfully, and the personal information you provide on the census is confidential. So please do not fill out the census because you're concerned about that. Lastly, to wrap it up, as I always do, I just want to thank every single person who is out there on the front line working to protect all of us from this incredible and incredibly tragic pandemic. So all of our medical professionals, our nurses, our doctors, our hospital staff, our police, our fire, our town staff, our school staff, everyone out in the grocery stores, the pharmacies, the truckers who are bringing us the food that we need. You are all incredible heroes, and without you, we wouldn't have survived this. So just thank you for the risks and the sacrifices that you are taking. I will always fight for you, because what you are doing right now is incredible and we need you, and we are so very grateful for you. So I'm going to wrap it up there. We do have a resource page, megwheeler.com/COVID. This is constantly being updated, so please feel free to visit that. Somebody on Instagram says she took the census, and important, you can take it without the code. That's really good to know. So you can take the census without having the code. So if you haven't received that in the mail, then definitely go ahead and do that. All right, folks, thank you so much. As always, I'll be back here tomorrow night, 7:30 p.m. I will be here every single night, 7:30 on Instagram and Facebook, giving you an update on the COVID-19 status for as long as I'm able to until this is over. Please stay safe, stay healthy, and reach out to us if there's anything at all that you need. Have a good night.